Hello, it's Dr. Rhonda Johnson. Today is Tuesday, January 12th, 2021. Well, I am just so excited to share this good news. This is probably the best good news I have shared since this pandemic started. Well, what am I talking about here? Well, I just finished watching the news conference by the officials of the government that are involved in Operation Warp Speed. Well, forget the politics, folks. I don't care who gets credit for this, if it's Democrats or if it's Republicans. I'm just grateful for one thing. They are going to release the vaccine, all 38 million doses that the federal government is now holding. And you know what? The coronavirus doesn't care. Doesn't care who's Democrat and Republican when it infects people. It doesn't care if it's male, female, young or old, black, white, doesn't care about your religion. So here's a summary of the changes. So what's going to happen? As I mentioned, the vaccine supply is going to be opened up. The federal government's releasing all 38 million doses to the states. So who is this going to impact? Here's the good news. Now all people 65 and up can get this vaccine. And also all people who are 18 to 64 who have documented comorbid conditions can get the vaccine. So translation, if you're 18 to 64, or if you have high blood pressure, asthma, sickle cell disease, if you're a cancer patient, if you're immunocompromised, if you have HIV/AIDS, if you have diabetes, obesity, etc., if you have a comorbid condition, you can get the vaccine. So what kind of documentation is needed? Well, they didn't say yet, so I can't tell you that. Stay tuned for updates from your local health department. Now, when is this going to happen? It's supposed to happen within the next 2 weeks, they said. Now, they're going to allocate the vaccine, the federal government, to the states based upon the population census of people who are 65 and up. And states who have given out more vaccine doses so far will get more vaccine. They want data on who's getting the vaccine. So again, I don't know this yet, but when you go to get your shots, you may need to have some type of documentation of an address or a driver's license. Again, I don't know, but they are going to be required to collect data. So you'll at least have to give your name, probably a birth date, and age when you go get your shots. Now, why the change? According to these officials, the number of cases is spreading. The hospitals are running out of capacity to care for the critically ill and the sick. And they also said that some states are micromanaging their vaccine supply and sticking to rigid distribution of phase 1A, phase 1B, phase 1C. And they cited successes from states that have just kind of opened up the vaccine to people who need it, like West Virginia and Connecticut, they said. So they also say they want to prevent one more life from being lost and one more hospital bed for being occupied. So again, I don't care the reasons why they're doing it. This is a good thing. So now the other important thing is where you'll be able to get these vaccines. You'll be able to get them now at retail pharmacies. So they said they're going to increase the number of retail participating pharmacies and federally qualified health centers. So if you live in a community where there's a federally qualified health center, you'll be able to get the vaccine. I think we're going to see many more options, including mass vaccination clinics. Again, I'm old enough that I remember being in these long lines to get the polio sugar cube. I remember being in long lines to get the measles and mumps and the rubella vaccines. So I am dating myself. But, stay tuned to more information about how these vaccination options are going to play out. Now, remember that we're talking about 38 million doses. We live in a country where there's 75 million people. You take away the 75 million children, there's still a whole lot more people than there are available vaccine doses. So, folks, it's time to think, plan, and act. Think, about your decision. I've been talking about these vaccines a lot, and you've been hearing them on the news. So by now you should have at least a little bit of an understanding around how these vaccines work. And you should also know your risk for getting COVID. I hope that you have had time to think through your feelings and also manage your fears of the unknowns. Plan. Think about and plan where you're going to get this vaccine. You're going to get it at a pharmacy. You're going to get it at your PCP. You're going to try to get it at a federally qualified center. You're going to try to get it at a mass vaccination clinic. I know it's hard to plan when you may not know the details yet, but as soon as you hear the details, be planning. Put your plan in your mind. Next thing is to act. Think, plan, and act. If you have a PCP, contact your PCP. And don't wait till the last minute, folks. Let them know that you want to get this vaccine, especially if you're 18 to 64 or if you're 65 and up. Hopefully you'll know, they'll know what kind of documentation is needed so that if you need documentation, you'll have documentation. And watch for information, news, social media, word of mouth. This is a time that I want everybody to be the town crier. If you know about a vaccination clinic, tell everybody, tell all your friends, tell all your family. Let's get the word out and let's get shots in the arms of people who need them. Now, in the meantime, folks, be ever so careful. The virus is like a raging fire or a tsunami or a Category 5 hurricane. Pick any kind of disaster term that you want. That's what this pandemic is. That's what this virus is causing. Now, the outgoing director of the CDC, Dr. Robert Redfield, was at this conference. And now he said most transmission is occurring house to house. Well, I was reminded back of when I was in practice, and I used to tell my patients, I worked in a city clinic for a long time, don't share needles. I used to treat a whole lot of addicts, and I would always say, don't share needles. Well, right now I'm going to say, don't share houses unless it's absolutely necessary. Hunker down, stay home, go out for what you need to go out. But now's not the time to be visiting a whole lot of people inside their homes. If you have to go to somebody else's house, limit your time there and keep your mask on. Don't eat or drink. Keep your mask on. We got some Super Bowls coming up, playoff games. Look, everybody watch it on their own TV. I don't care if your friends have, a 90-inch screen TV. This year, watch it at home. Okay, remember, also, if you've had COVID, wait 90 days to get the vaccine. Now, if you've had the flu shot, wait 4 weeks, or you may want to talk to your doctor who might recommend giving this opportunity to get the COVID vaccine. If it's been 2.5 to 3 weeks, it might be okay. Now, if you have certain allergies that require you to use an EpiPen, you need to talk to your doctor about where you should get the vaccine. Maybe you need to get it in your PCP office versus getting it at a retail pharmacy. Expect to have some side effects, soreness, fever, soreness at the injection site, tenderness in your arm. You might feel achy, you might have chills, you might feel tired, and you might not have anything. But if you do have any symptoms, that means the vaccine is working, and that's a good thing. Lastly, there was one more important bit of advice given at today's conference. And they said, if you get COVID, if you have COVID, and you are at high risk for developing complications, meaning you're 60 and up, or you have co-morbid conditions, high blood pressure, diabetes, asthma or lung disease, or you've been a cancer patient, or you're obese, look, ask your doctor, ask the emergency room why you are not getting the monoclonal antibody treatment. This is what they said at this conference. They said the monoclonal antibodies, that's the treatment that President Trump got and got better so quickly, are available, but they are sitting on the shelf. Now, they do have to be given through an IV. They have to be given through an IV infusion at a place that can handle any type of allergic reactions. and have emergency capabilities. So that's it. I'm glad to share this good news. You'll be hearing about it on television, but in the meantime, think, plan, and act. My views are my own. This is Dr. Rhonda Johnson. Have a blessed day, folks.